welcome to the Talking Cure podcast, where we talk all things mental health. Lebitso la ka ke Lebohang Maskhonyana Bereng. I'm a counseling psychologist in private practice at the Psychological Wellness Center here in Maseru, Lesotho. Today, I'm super excited because we're going to be talking about the regulation and standardization of the health professions within the country. And today we have members of the Lesotho Medical, Dental and Pharmacy Council, Dr. Mohalinyane and Dr. Tawana. They're going to introduce themselves. Welcome, Ndate Limme. We are delighted to have you today.
Lebohang.
Thank you, Mayor.
Galeboha.
Yes, Lebo.
Before we even introduce ourselves, I want to start first by saying, how are you arriving? We always check in because this is a mental health safe space where we just check in to say, how are we arriving today? How are you doing?
All right, let me start. I would say for now, yes, the day has been hectic. But I arrived, I relaxed, I sat down, and I'm fine now.
Okay, good to hear you're fine, Dade. It means re tlo kena kgabong re qoqe ditaba tsa rona, and I'm really looking forward to that. Ke a tseba hore le Basotho are looking forward to hear about the council. Dr. Tawan, how are you arriving?
Yes, likewise, my day was hectic. As usual, maybe I should start to relate my day-to-day job. Besides being in the medical council, I'm a dentist by profession. So unlike medical doctors, our field, our job is quite hectic because you just see a patient and then you have to do some diagnosis, maybe like not clinically, but you have to maybe take an X-ray and the like. So you'll be running around doing this for just one patient. And then you may even come across a complication. Like today, I had a complication even before coming here. But I managed to execute everything. Then I was able to come.
Okay.
Yes.
Okay.
Yes.
It's good to know that and to have a sense in terms of what you do as a dentist and what it really involves. Because us, when we come as patients, we only see when you're helping us. We don't know what is happening in the background. And before I move on to Dr. Mohalinyane, I think, Dr. Tawana, as a way of introduction now within the council, what do you do within the Lesotho Medical Council?
Okay. At the moment, I'm holding the position of a registrar in the Lesotho Medical, Dental and Pharmacy Council. Because I have this other job, I'm not there full time. I'm acting now before they can have someone permanent in the office.
Okay. Thank you so much, Dr. Tawana. Dr. Mohalinyane, over to you. We would like to know who you are and the role that you play within the council.
All right, ke leboha haholo mme. My name is Kupa Mohalinyane, a medical doctor by profession currently. I've been a scientist from NAL, and then went to UP for masters, still in science. Then I progressed to medical school, and currently I'm a medical doctor. I am currently placed in Queen Mamhato Memorial Hospital, Department of Internal Medicine. So, like Dr. Tawana, I'm partly at the council and then still doing the job as well. So at the council, I'm holding the position of the deputy president. So I would say for our council, being at the council, it's like a full-time job because we are sort of a compressed council without a secretariat. So we are the secretariat ourselves. We are also the authority, the site. So we have to draw the mandate, deliver the mandate, and execute the mandate as well. So we plan and then put in practice. So it's sort of a full-time job. And as you know, our council initially been planned to regulate the dentists, medical doctors, and pharmacists. But now it seems like besides the nursing profession, everything has been put under us. That also aiding the burden that we are having as well, because you have to go extra mile. Sometimes not being familiar with certain things, you have to benchmark. You have to go around, ask, do your research, ask the professions in the professions of the related field that you are working with. And then you come down, set standards, and then execute. So it becomes a full-time job as well.
That really sounds like it's a lot of work. Being able to plan, to execute, to implement, it really sounds like it's a lot, but I believe that it's worth it and it steps in the right direction. I'm glad, Dr. Malian, you mentioned that initially the council was set up to service dentists, medical doctors, and pharmacists. Because as a psychologist myself and as part of the council, I'm always like, I don't see myself there. And I know you're working, you're in the process of advancing and make sure that you incorporate all the health professions within the council. So we're looking forward to the developments that I know are already happening within the council. But maybe Basotho would like to know, Horena, what is the mandate of the council within the country? When we talk about the Lesotho Medical, Dental, and Pharmacy Council, what is your overall mandate within the context of Lesotho?
All right, thank you. As the council or as the regulatory body, a statutory body that was built and acted by the Act of the Parliament long time ago anyway. In those times, there were no acts or bills. It were still orders. 1970, Order 13 of 1970. So we are a statutory body, independent. That means we are not influenced by anyone. We are not funded by anyone. We are not supported by anyone. The only source of our income is coming from the registrants that we are presenting and representing. So our mandate as a regulatory body, we serve to protect the public, protecting the public from the very same registrants that we are representing, making sure that they are safe practitioners that can work under safe conditions in order to make sure that the public is not harmed. Because one of the principles of medical ethics is first do no harm. So we make sure that there is none maleficent to the members of the public. So so that is our first goal and mandate, that to protect the public, but we do not end there. We also make sure that we set up and determine the standards of practice, the standards of practice and the standards of education for the practitioners, as well as also determining the standards of practice itself. So setting up the standards for the practice and the medical practitioners, making sure that they are all saving within the limits that they have. No one goes beyond what their expertise or field of expertise is, because then they will cause harm to the patient. So it's also important. As I've said, also the training, education and training as well, determining those standards. Safety starts where the training is. So we make sure that our training in our lady standards in a lady the guideline it's in a scope of practice it's in a le hore na ba tlameha for a certain discipline ba train jwang ba be trained jwang ba tsebe, so that then by the time melong hore they are going to handle the patients, then they are safe practitioners as well.
Yes.
So when they arrive, we make sure that we scan through all those habafihla.
And let me interject, Dr. Manye. Who is they? I know that as a psychologist, I tend to just look at myself and my profession, but I know that as the council, before we jump into the process of how usually they would go through the registration process, what are the different professionals that you cover? Is it everyone? Is it a certain area? Who do you?
All right. As I said initially, when this council was founded, it was supposed to regulate only 4 professions. But now, when the field of professions were expanding, there seems to be only 2 professional regulatory bodies in the country, health professional regulatory bodies in the country. The other wing being the nurses, they have their own council. And then everyone else was thrown to us. So initially the council, even its structure, maybe I should cover the structure of the council there. So according to the order that dictates the structure of the council, there are 4 medical practitioners that are elected by the practitioners themselves. Then there is 1 dental practitioner elected by the dental surgeons and the dental practitioners, let me say that. Then there is 1 pharmacist elected by the pharmacy practitioners.
Okay.
Then there is a wing that is elected by selected by the minister of health at that time when the elections are occurring. So he will elect a dental practitioner, he will elect 2 medical practitioners, he will elect a pharmacy practitioner as well. So all in total, that means council members would be 10. Okay. So you can see from this structure, we are not including the mental health. So I think in the beginning you asked, where are we? So yes, for the longest time, it has been like that. But when we arrived, we saw the challenges that we are facing with this type of a compressed council. That because, a lot of things that would be worked upon would be those that we are expertise in. Like would be looking much, it will be easier right now working with the medical practitioners, medical doctors and the related fields. It will be easy working with the dental practitioners, very easy working with the pharmacy practitioners. But now when it comes to mental practitioners, it becomes a challenge.
Yeah.
That's where I was saying now, that's where sleepless nights will come. Because, when the practitioners, mental practitioners come, they expect that we should be we should be up with our game.
Yes.
So now that's where we will benchmark. That's where we'll consult
Yes.
the professions that we have here, professionals that we have in the country, even go outside. And then ask even our sister councils outside, the even regionally as well, even across the continent. How do you guys work across such a challenge? Then we sit down, throw up the standards, throw up the code of conduct, and then such things. So it becomes very challenging. But anyway, we are working on that.
And I know you are, because at some point we, as the Psychological Peer Credential Society of Lesotho, we've had an opportunity to have a meet and greet and a sit down of getting to know the council and the council getting to know us. Because, I always make an example, like with the disability people, they always say nothing for us without us. So we really appreciate the fact that you're reaching out, you're incorporating. It would be very difficult if it's not specifically your sphere of practice for you to know the details, the qualification, the registrations. So we are delighted to be part of the Medical Council, and we know that we are all building together to make sure that we get to a point where all information is there, and we are working together, collaborating to make sure that all professions are protected and standardized within the country. Yes, that is. Maseru, as a registrar within the council, I would like to just go a little bit deeper in terms of what your role is. And I know, like Dr. Mahalyan was saying, you're probably doubling and having many different roles that you play, but still going back to the mandate of the council, but specifically in your role. Also, we were just talking about when the students now come back, when they've completed their studies, coming back now into the country to register. I know probably that is the first stop that they come into. What has your role been within the council when it comes to that?
Okay. Yes, Melebo, the role of a registrar is to ensure that every professional is registered under under our council, under the order that is in place, which, like Ndate Mahalanyane is saying, is going to change to incorporate other disciplines. So when students just graduated, they need to have all their documents ready, starting with the transcripts. They should have a transcript and a certificate for that course that they qualified. And then, yes, we would need even primary certificates to show that this is really the person coming. Some people can forge results.
Oh, yes.
Yes. They
just
may
to
not
be able
pass
to analyze the whole process.
Yes, then they may
progression.
not pass their matric, and then you'll find that person didn't do well in the matric, but now they are qualified as maybe psychologists or a dentist. So we have to ensure that, yes, they went through all the levels of education.
Oh, yes.
Yes, so that is also essential. Again, okay, there's a fee that has to be paid. Yes, so I make sure that when the application comes, it has a proof of payment. Then we can start to talk now that, yes, you qualify. If we see there's a discrepancy somewhere, we reject the application. And then, yeah.
I've realized that with modernization that is happening these days, that the council is keeping up with the times. Back in the days when I first registered years back, I would go to the council with the, physical papers and apply. But for the first time this year, when we did the renewal, we were told by your office that, hey, everything is online now.
Electronica.
Please do everything electronically. I was really impressed to see that we are moving with the times. I assume that the process is still the same, even when it's done electronically, in terms of the requirements that are needed, whether somebody's registering for the first time or whether it's a renewal.
Yes, it's still the same. I would say it's even more improved. One thing that is of importance is the person has to be from an accredited school.
Oh, yes.
That is very important, because if you are from a school that is not accredited, then you will have to pass through certain exams that you will have to pass before we can allow you to practice on Basotho, because at the same time we can't allow Basotho to be guinea pigs, for someone who did who attended a dodgy school that no one even recognizes or no. So
because it means the skill is not there, and therefore the harm will be done to the patients.
yes. So because at every point when you are registering, there are point of checks. I think there are about 4 checkpoints
Okay.
that the whole the application goes through. So you can get rejected even if you can bypass the first one, but you can't bypass all of them.
Yes.
So it's very hard. I know a lot of people were saying it looks like the council now seeks a lot of things. It looks like the council is troubling them and such things, such comments. But all we want is to make sure that there is quality. And I should say, we don't care for how long the person has been practicing. Because obviously someone could be a non-profession in mechanics, but if they have been watching people doing that for a long time, they can know how to join a few threads here and there. And so it doesn't mean that for someone that they have been practicing for 10 years, that now they can say, okay, they have been here now, the whole process will be smooth. No, there are people even right now as we speak that we rejected their applications. They are still out there. And then we are coming for them if they are practicing very soon.
I was about to ask that, Dr. Mahalanyane, to say, what if I bypass the council, set up a private practice? I may not be qualified. For example, we did an episode earlier with a clinical psychologist, Mebusa Munyamani, and we're talking about how in our training, because you need to have the first degree when we're talking the South African context, your second degree, which is your honors degree, you still can't practice with an honors degree. You only start consulting under supervision when you do your master's level. And after that, you do now your internship and then write board exams and be able to qualify. But I know in our context, and because there's been such a lack in the context of mental health, for example, I know people that are practicing only with their honors degrees, for example, which can even be more dangerous. You would rather go see a registered counselor because they have the practice, they have the theory, but they have the practice at the same time. What do you say about such people that bypass the council and then set up practices, not just in mental health, whether they are medical doctors that are not qualified or claiming to be dentists but not fully qualified? How do you deal with that as a council?
Yes, such a practice, we call it a bogus practice. That means a non-recognized, non-regulated practice, type of a practice. And according to the act or the order that regulates the council, such people, they can even be imprisoned. So I know for the longest time they have been going unpunished, but now it's a different era, as we have all seen. It's a different era. It's a new council. it's a different type of a council. So we are going to do what we call spot checks or facility checks and field checks, starting the 1st of May. That is like tomorrow. So we will be coming for them, and we will be checking such things. Unfortunately, there are a lot of practices that are bogus that are going to be closed. There are a lot of all spring pharmacies, all these facilities like the medical facilities where the doctors, without being properly licensed, are opening the clinics. So all such will be closed, and then people will have to go through necessary processes, and us ensuring that they are safe to touch on Basotho out there.
And I hope Basotho can understand that this is all for our benefit, to make sure that the services that are provided there, they are provided by clinicians that are qualified and know exactly what they're doing in order to avoid harm. What are some of the challenges? It can be in the mental health space, for example, or generally in any other health profession when it comes to regulating, for example, that you may find within the country. For example, I've just talked about what if somebody bypasses the council and just sets up a private practice. You've just talked about, or you're going to start with the spot checks. And that says even for professionals also, qualified professionals, we need to make sure that our continued professional development, for example, is in place, because I know there are requirements. I would want you to talk about that. I know that you've been working very hard to make sure that you implement that. I attended one of your stakeholders meeting that we were working on the CPD development within the country for different health professionals. So let's say, for example, whether it's malpractice for somebody who is qualified, or I went to a pharmacy or a clinician that I thought they're qualified, and now I realize that there has been damage that has been done, and probably this professional is not even qualified. What are some of the steps that I can take as an individual towards the council, and what is it that I can expect to happen on the other side of the reporting?
All right. I think you asked a lot of questions. I will try. The first one in the challenges that we are facing. So, for the longest time, everyone can do as they wish. Unfortunately, such a time is over. I think immediately we stepped into this office, it was past that time. So now people are going to feel, I know a lot of people will be crying. As Basotho, we have been acclimatized to this condition of bogus practice to a point that we think it's making our lives a bit easier, because they will be practicing unregulated, unprofessionally, so they tend to be more cheaper than the services that are regulated. So Basotho seem to see it as an advantage, but at the same time there is a lot of harm. Yes. We have gotten the reports, we have seen even on the newspapers and everywhere, complaints on the radios and all around, that there is more harm that is being done.
We see it even for me, for example, as a counseling psychologist in private practice, when somebody has gone to see a mental health practitioner and there's a lot of damage and even malpractice and abuse of clients and patients, you can tell when some things have been done that are unethical, and the damage that has been done and the work that goes into undoing that can be a lot. So I just wanted to testify to that yes, you can continue.
Yes, so for the longest period of time, yes, people have been surviving that. And yes, I should confess that, it's very difficult and challenging. Like, say, for example, none of the council member is a psychologist or any of the mental.
I guess we are challenging you
So,
to have a psychologist or a psychologist or mental health professional within the council, because I think it will also make your job easier.
yes, so that's where we are driving to. So because we have seen the challenge, and as young people who would want to see a change, we can't just comfortably sit there and say, okay, it's fine. Well, anyway, it's the law. What can we do? We have to make sure that there is a change, because we do not want this type of a struggle repeating itself, being recurrent continuously. So yes, it's a challenge, because right now I remember you were talking about someone having an honors degree and not being allowed to practice. And I can tell you a lot of people are practicing, because there was no tight regulation on that. So I just remember that we rejected the registration of one of our registrants that was trying to register, and then they were trying to explain that no, that there is what we call the clinical psychologist, then there is a psychologist, and then you see it becomes a problem right there, because now they are talking a language out of my league. Now I would have to call you and call them, then say, okay guys, explain which one is which. One of you said this, and then when I thought I understand it, someone comes and explain it in the other way. So when we had the mental board within the council, it will be easy, because it will be professionals in that field working around that. Then it will be just very, very easy to work around such a thing. So it becomes a challenge right now that we have none. So you see, we have to be going up and down, consulting, calling up people, they explain. Then because people will take chance, they know none of you is professional on that. Tomorrow they give an additional explanation. Then you feel like it seems like it makes sense. So
And I think, let me take advantage of that, because in the previous episode, we did talk about the different categories. Every psychologist has a specialization, whether they are clinical, counseling, neuro, forensic, research, educational. Somebody has to be able to say, I specialized specifically in this category. But I think it's also important, because we are at the stage where we are growing. And I know we need a lot of psychologists within the country. We can't just place people, of course, and say you're a psychologist or you're qualified and you can go ahead and practice if you are not. But I think it's also important to come together. The point is to say, let's stick within a scope of practice in order to avoid harm. But we also want to encourage, for someone who already has a master's, an honors degree, for example, we want to encourage them. Look for the resources, see how we can support them to be able to say, go complete your studies so that you can be licensed to now start seeing. So it's not just about pointing fingers. Of course, we need to point out what is wrong, regardless of what profession it is. But at the same time, for me, and I think what the Psychological Society is trying to do is to say, let's come together, let's call all the students, let's see what is it that we can do. Let's talk to the ministry to provide scholarships. Let's talk to institutions, for example, with the networks that we have of our previous institutions in South Africa or elsewhere, to make sure that we support them until they qualify. But at the same time, you do not practice because you will do more harm as long as you're not yet qualified. So it's not just about chucking them out. It's about saying, let's come together to see how we can help you to be able to get there, instead of just practicing without, because the medical council will come for you either way if you're out there practicing without being licensing. So I think it's very important point to bring up. And Metabo, I know we've talked about the students now when they come and they register. And I'm glad that both of you are talking about pulling us in to say, okay, in this particular profession, we know we have people that are qualified. And I think you do have resources. You have the for example, the Psychological Society. And I know you have local people, you have people outside the country. Whether we're talking about medicine, whether we're talking about dental practice, whether we're talking about mental health, you will find in most countries, the qualifications are more or less the same. We still have to go through the same routes that we need to go into. So when it comes to now making sure that we are regulating those professions, Dr. Mhanyan, for example, has just talked about the boards within the council. Mosotho may not understand now what are we talking about when we talk about the mental board, for example, mental health board within the council. What are the other boards that you're looking into within the council so that every professional may feel like I also belong, who may not be part of pharmacy, who may not be part of dental, who may not be part of medical doctor, or the main ones that were there when the council were established. For example, I'm thinking, I know I've met young people that occupational therapists, for example, that have just qualified. They're coming back into Lesotho. They're trying to enter the market, but they want to do things properly, and they need to know. It's important to network, of course, with other professionals, but what other boards are there specifically so that somebody who is out there and thinking, oh, I also belong to the council, which means even before I apply for a job, and I guess we're also talking to institutions that when they hire any clinician, they need to be able to check first, are you registered with the council? Because it's another way of checking whether this person is qualified, because an institution may not be able to just vet. So what other boards are you planning to have within the council to make sure that everyone is covered?
I don't have the count, but there's laboratory services. We need somebody from the lab, physiotherapy and occupational therapy, like I say. I think that Mahalangi will remind me some, because it's something that is in the pipeline.
Oh, yeah.
Yes, so yes.
So we have the medical board, the dental board, pharmacy board, mental health board, emergency services or emergency.
Your paramedics.
Yes, all those emergency. Then we have the physical therapy board. That's where we will have the physiotherapies, all the therapies. That's where you'll have all of them. So the physical therapy board. Then we have what we call it's is it EENT? That's where you
EENT.
Kappa, is it EET? Something like that, but that's the abbreviation. But that's where you have the ENTs. You have the audiologists. You have people working with the eye in all their fields. So that's how we are trying to group so that similar people could work together. Yes. So the way we are planning it is that all these boards they will have certain number of members. We have to do a lot of consultations. Say for mental board, for example, I want to know the levels of professions, but I would want that in the board. Then you have different levels of profession, like specialties in that.
Oh, yes, within mental health field, yes.
So that you have different levels of knowledge within the board, so that when you have someone who is a specialist in that certain field, you don't we don't meet a challenge whereby we don't even know now who is going to assess the special person. But when you have specialists in that field in the board, then you know it's easy for them to set the board exams up to the standard of the qualification of that person. So it makes work easier. So that's how we are thinking of it. Then the registrants will elect members of the board. Then members of the board will then take people from the board who will go to the council.
I see.
Yes. So that means now you will have people in the board, on the mental board. Then you say, okay, if say, all right, say you are supposed to elect, say 2 members. Then you say, okay, so and so and so and so can represent that. Then the board members will vote for who goes into the council. Then you have a representative in the council. So that's how we are actually looking at it. And of course, yes, we will. It also encompass changing the whole act. So we very soon will have a bill. Would have drafted a bill that will then be presented. After presentation, multiple presentation, now it will be an act.
Yes.
After the act, now the whole structure will be in place.
Yes.
Then even the name will have to change. Now it will be Lesotho Health Professionals Council, not
Including all of us now. No, this is really exciting because it paints us a picture in terms of what is to come and the work that you're doing as a council, which we really appreciate, because I think for the longest time in Lesotho, like you said, that anything just goes. And I think Basotho historically, we are a very strong, beautiful nation. We have a lot of educated people in this country. We can turn this country around. I always say we are the ones, like President Barack Obama says, we are the ones we've been waiting for. We can't expect anyone to come and transform our country. And to see the progress and the changes that the Medical Council has been doing, it's really impressive. As a member within the council, it's so encouraging, because even just in our own mental health sphere, with the little change that we are trying to do, we believe that it will build up towards what the council, the overall regulatory body, is trying to do in terms of standardization. So from the both of you, what would be a key message that you would like to give to Basotho as a parting message from the council, and maybe what they can expect in the future from the council?
All right, let me start. I would say we did recently. We did a press release because we were worried about a lot of Basotho that didn't know where to complain. They had a complaint either with the institution or with the individual professions. But they will be going to social medias where, yes, they will get compassion. But at the end of the day, no solution is done. So, and then it ends there. Tomorrow in social media, also we are busy again with something trending. We have forgotten about their case. But if they can then know the proper channels to report that all the registrants that are registered with us, we are regulating. We are also regulating their standards of practice, their code of conduct, and ethics and everything. So if ever Basotho feel like, okay, in certain things, then they are welcome to report to the council. Very soon we'll be having what we call a whistleblower, where someone, if they are afraid to report directly, then they can report anonymously, give us a tip as to where a certain malpractice has been done. Then we'll go there, do our investigations. When we get that we have something tangible, then we can call the registrants, and then 2 things can happen. They can either be called to disciplinary hearing where they will be disciplined. That means we can correct or then dismiss. So corrective measures, we call them, and then discipline them in trying to correct the behavior that has been portrayed. Or then if the behavior is more dangerous, then they could be dismissed. Dismissal means now they can no longer practice, or they can be sent to jail. Or if they are coming from outside, then we deport them to their country. We blacklist them in the regional and even the continental body so that they won't be practicing. Maybe until, I don't know.
Yeah.
So
or never.
Or never even practice at all. So we have that mandate of giving licenses and even revoking those licenses, or even completely deregistering a person, rendering them unworthy for practice at all. So if they can know those routes, then I think they can get a help that they are seeking for. So instead of seeking compassion to the social medias, then I think they should report to us, because these people are answerable to us.
Yes.
Yes.
When he says these people, he's talking about some of us. I know, Dr. Malinyane. And your parting words, Dr. Tawana?
Yes, I think Dr. Malinyane has summed it all up. But I would really say encourage people to feel free to come to the council if they have observed some medical malpractice anywhere, like if they know of any bogus practice that is out there, that the council is not aware that there is such a practice, it should come and inform the medical council, then we'll take it up.
Where are you currently based?
Yes, I was coming to that. We have moved offices to Maseru West, Caledon Road.
Lancers Road.
Yes.
Lancers Road.
Yes, house number
56.
Yes. Yes, that's where they can find us.
Okay.
And I'm very sorry. Let me say in closing, I should say, we know there are a lot of pharmacies, chemists out there. Perhaps I should mention those that are acting beyond their scope. There is what we call the scope of practice. A lot of them have turned themselves into doctors. They are consulting there. There are certain, there are differences between a chemist, a pharmacy, and all those in terms of the medications they can give, and in which condition. There are certain medications that they are not supposed to give even without prescriptions. But unfortunately, the current practice is that they are just giving everything for the sake of money. And that is posing a danger to the public, because we are seeing a lot of resistance pattern in terms of this medication, that a lot of these bacteria, viruses, and all these bugs are no longer responding because of misuse. So that needs to be regulated as well, and I should say we are coming for that.
We ikutlwetse Mosotho wa hae, so it is our responsibility to make sure that we go to the right practitioners, make sure that they are qualified and licensed in order to prevent harm, and also even for the qualified ones to hold them accountable to the standard and the ethics of practice, making sure that they're practicing within the scope of practice. We are grateful to the Lesotho Medical Council for the work that they are doing and for being with us today. Until we meet again, remember to subscribe, to share this episode, because you never know who will need this information, and we'll be definitely sharing their contacts. Until next time, Haebe Khotso.